Today from the Centers for Disease Control, that minor bug we used to cure with a quick prescription might become the very thing that puts you in the hospital. Medical reporter Liz Bonis asks experts at TriHealth about superbugs in today's Medical Edge.
Good morning, Dr. Blatt.
Good morning. How are you, Miss Groh?
You know what, I'm doing
Mary Groh was back home after cancer treatment recently when suddenly she noticed
I didn't feel well. I didn't know what was the matter.
when her doctor took a quick blood test.
And he said, go right to the hospital. Don't go home. Do not pack a bag. Go right to the hospital.
Once here, she found out not only was a bacterial infection spreading rapidly in her body, but she also had pneumonia. Both are common health concerns that right now are fairly easy to treat with antibiotics. But a new report from the Centers for Disease Control says we are entering into a new era of superbugs, which means bacteria are mutating and outsmarting these traditional treatments. The problem is that could lead to a major health concern where a simple antibiotic that used to treat a problem simply doesn't anymore. And that means you could die of that problem where a treatment used to work.
If the antibiotics stop working for routine bacterial infections, we may see patients dying of illnesses that we could cure 2 or 3 years ago.
Dr. Stephen Blatt is an infection control specialist who's been closely following this trend.
But we're starting to run into problems now as the bacteria get more and more resistant. We're starting to see some infections that are very difficult to treat and in fact resistant to many of the antibiotics that we've used over the years.
Mary Groh is one of the lucky ones. She says within days her infection and pneumonia did respond to the antibiotics she was given. She says now on a scale of 1 to 10 in terms of how much better she feels.
Today, 10. That is a miracle antibiotic, and I hope I don't ever become resistant to it.
Others, however, may not be so lucky.
The one that's become really infamous lately is called CRE, and that's a kind of bacteria that routinely had caused minor urinary tract infections, but is now starting to become much more resistant to antibiotics, and in some cases, especially in patients who have been hospitalized, we are running completely out of antibiotics to treat that organism.
In some cases, older antibiotics are tried, but many can cause serious complications, such as liver and kidney damage. Dr. Blatt says the only real answer is in new treatments for these superbugs. Otherwise,
and patients are going to succumb to those resistant infections where we could have cured them, in the recent past.
At TriHealth's Good Samaritan Hospital, Liz Bonis, Local 12 News.
Those new treatments may have to be funded through government research because there's not a lot of profit for pharmaceutical companies to make superbug antibiotics. Remember, we welcome your questions for providers at TriHealth. Just go to local12.com and click on Ask the Expert.